catastrophic. It's terrible and terrible. No words can describe it. For the last few days, we are sending a call for the human community that in the hospital we don't have fuel.
Absolutely horrific, is it not? I mean, I came across a message yesterday which suggested, let me just get it quickly. Whilst I'm looking for the message, let me also tell you who my next guest is from one humanitarian organization here at Salam Media. Alhamdulillah, we're talking with another humanitarian organization this morning, and that, of course, is with to Doctors Without Borders, and the spokesperson is Monica Genya. She is on standby, and we're going to be talking about obviously the situation in Gaza and their role going forward regarding this crisis, this humanitarian crisis, and that's exactly what it is. We viewed that clip a minute ago, and being with an organization like Doctors Without Borders, Monica, what do you make of that?
It is actually horrific, the circumstances that we find ourselves in at the moment. Our doctors are not able to reach patients. Patients are not able to reach hospitals, and supplies are not getting in the way they should be.
Are you saying to me then that currently Doctors Without Borders are that you have volunteers on the ground in Gaza as we speak?
Yes, we do have volunteers on the ground. We have our colleagues who actually live in Gaza, and they work with us. And they are still volunteering at hospitals, even though supplies are not coming in. We have international staff on the ground as well. And we have more international staff waiting to enter into the area so that they can support. We also have medical supplies on standby on the other side of the Al-Rafah border crossing.
And we do know that the Israeli occupiers are not allowing those supplies to go through. They're using all sorts of excuses and means possible to stop those much needed supplies to get to the hospitals. Fuel is in absolute high demand. Without fuel, they can't run the generators, they can't, they can't operate, etc. I just want to read this little message to you as well, and then you can respond to my statements. Doctors who are reporting directly from Gaza say they have not been trained to treat what they are seeing right now in this genocide. Burns in the fourth degree, etc., which are not even described in textbooks. And in that clip that we viewed just now, the doctors were suggesting because they don't have much needed medication, anesthetics, etc., they are actually using vinegar as antiseptics, etc. It must be absolutely horrifying for you and Doctors Without Borders to be faced with this type of a situation.
It is very horrifying and extremely frustrating and heartbreaking for our medical staff and for all our staff, especially knowing that we have 26,000 tons of medical supplies waiting in Egypt at the other side of the Al-Rafah border crossing, have been waiting for days. There is a lot of bureaucracy that is preventing the medical supplies from coming into the enclave. We've been waiting to treat the 26,000 tons will treat 800 surgical interventions. So they're much needed. We know it's a drop in the bucket. We will be able to send more as soon as the crossing is opened up in a way that we can access our staff on the other side.
Monica, what is also very disturbing and I should imagine horrifying, there isn't even a word to describe what's playing out there, but what is disturbing And horrifying is the fact that hospitals are being bombed and there are innocent doctors and medical staff that are there out of the goodness of their heart to help sick, injured people, and they being killed in the process as well.
Absolutely. MSF has called repeatedly for violence against humanitarian staff, against hospitals to stop. There is no justification for bombing hospitals full of medical staff, full of patients, full of children. There is absolutely no justification for this.
Okay, earlier this week, Dr. Mohammed Obeid, a surgeon in Gaza, described the following: hospitals are flooded with patients, amputations, and surgeries are being carried out without proper anesthesia, which I just mentioned a few minutes ago. And more horrific is that morgues are flooded with dead bodies. And they're unable to do anything about that situation simply because we heard from our correspondent from Jerusalem, and that, of course, is Abir Zayad. She posted a message saying that the grave sites are full, there's nowhere to bury the dead. There is no way to bury the dead. What is this then? Um, how does this then impact on doctors, hospitals, and medical staff in Gaza? What are they going to do? I'm sure because of the water situation and the lack of food, etc., already the area is totally disease borne. And if they're not able to bury the dead bodies and they're not able to refrigerate them in mortuaries, we do have a catastrophe on our hands, don't we?
Absolutely. And the catastrophe is already here. It seems to get worse every day. And every day that we are not allowed to properly treat people and bring them the care that they need, the disaster is just compounded. Every day we think that it is at its worst, it gets even worse. Unless we are allowed to treat our patients, the catastrophe will be unimaginable. It already is.
Let's understand your role and the role of Doctors Without Borders. I know it's an amazing organization, and they are really ready to even go into such dangerous situations in war zones like the one in Gaza. Would you say, from your discussions with your teammates here in South Africa, and I'm sure that you are in constant discussion with doctors all around the world doing voluntary work, that this is the worst situation they've ever seen, but despite that, they are still willing to go and help those that are in desperate need of medical help and support?
Yes, that's correct. This is the worst situation that many of us have ever seen. But the willingness, the drive to go and help is there. We are very frustrated that we're not able to access our patients who so desperately need us. MSF has been in Gaza since 1989. And has been there constantly supporting hospitals all over the area. We are present right now at Al Shifa Hospital, not able to give the medical interventions that we know that we're capable of giving, just because we don't have the proper supplies and we don't have the proper medical staff to handle, as you said, the level of trauma that is being seen right now. So we're hoping that this changes. We're asking all the actors involved to please allow this to change so that we can access our patients.
But it seems as if the Israeli occupiers are not willing to hear your pleas. They're not interested at all. I think they're absolutely intent on wiping the Palestinian people off the face of the earth. That's what it seems like, does it not?
We are really finding it difficult to access our patients. It's been heartrending and heartbreaking and so difficult for our medical staff, as you said, to operate under conditions that are so inhumane. In order to save a life, having to operate without anesthetic, it's just something that cannot be imagined. The situation must change. It must change in order for humanity to survive.
Okay, let me just read out something that your president of MSF International had to say regarding this current situation. He goes on to say, similar to what you have shared with us as well, helpless people are being subjected to horrific bombing. Families have nowhere to run or to hide as hell has been unleashed on them. And he goes on to say, we need a ceasefire now. This, of course, has been communicated by Dr. Christou, MSF's international president. Undoubtedly, he has tried to engage with the Israeli authorities as well to get much needed supplies into Gaza. And from what he has just said there, doesn't look like they have actually allowed the access of medicine and other much needed supplies to get to the hospitals where your people are trying to help as many people as they possibly can.
Yes, that is correct. And we are working as well with WHO. Like we said, what we're seeing on the ground is a lot of bureaucracy that is preventing the clearance and the movement of trucks across the border, even though the border crossing is open. Getting the tons of medical supplies through has proved impossible up to now. Days are going by, lives are being lost, while the red tape prevents us from accessing our patients.
And the red tape obviously has been there in a very deliberate manner with the intent of preventing much needed help and relief for the Palestinian people. Let's look at a supposedly not a worst case scenario, but let's assume there is a ceasefire sooner rather than later. Undoubtedly, MSF is going to want to get as many medical staff into Gaza as possible to assist all of the patients, and there are numerous patients. What sort of criteria would you put in place to get people from around the world to get into Gaza to go and help? And I should imagine it's not only medical doctors and nurses that you're going to need. You're also going to be needing psychologists, psychiatrists, etc. Talk to us about that need, and how can people around the world, those professionals, prepare to get onto the ground as soon as the borders are open for them to go in and to start supporting the Palestinian people?
Yes, thank you. We are in need of people who are well trained in trauma care, of course, mental health care, but even people like supply managers who are able to bring in supplies. And the way we do it is we will ask people to go to our website and click on the link that says Work With Us. Our website is www.msf.org.za. Work with us, and then you'll be shown a list of criteria that is needed. We will be in contact with you, and once the criteria is met, we will then bring you out probably to Egypt first, where emergency teams are on the ground, ready to enter into the area, much needed areas in Gaza as soon as it's possible. So our offices around the world, including in Johannesburg, are recruiting people who are ready to go to help in this situation.
And undoubtedly, once they land in Egypt, there will be a briefing session as to what to expect, what their roles would be, what and how they're going to interact with the people, where they'd be living, and all of those logistics will be dealt with in Egypt before they get into Gaza. Is this on a purely voluntary scale? When I say purely voluntary, they're not going to be paid for their services at all. Would they need to pay for their own tickets to get to Egypt? And what about their lodgings? Where would they stay? And of course, I'm painting a picture on post the ceasefire, and let's hope it's sooner rather than later.
Yes, our staff will be paid a small stipend. It's not big at all. A small stipend, and all expenses will be paid. So we will take care of transportation, lodging, etc. But it is a volunteer spirit that we are looking for.
Absolutely. How long do you expect people to commit time to commit to their stay in this type of a capacity, be it a doctor, a nurse, a dentist, and all of those different health professionals are going to be sorely needed there. In fact, from any and every area of the medical field um, is needed in Gaza right now. Um, that being said, the length of stay, they've got to commit to a particular period. What does that look like?
We usually send out our medical teams, our teams, for a period of 6 months to a year. But in emergency cases like this, our emergency teams wouldn't be on the ground for more than a month or two before being rotated.
Okay. And undoubtedly, they too, once they've served a stint in a war-torn country like Gaza, seeing all of the trauma that they're going to be subjected to, they too would need some sort of debriefing, counseling, etc. once they've served their stint, and would you guys, MSF, supply that support?
Yes, absolutely. There is a mental health debriefing and counseling available for all our staff.
We're going to wrap up now. Anything else we need to know?
Yes, please. Please support our efforts. Please go to our website, www.msf.org.za. Support our efforts. Join us on our journey. Contact anybody who you know might be able to help put pressure to allow us to get our medical supplies into Gaza.
And if I'm not a medical professional and I want to make a difference, I could do that by making a donation to MSF. Much needed, I should imagine.
Absolutely, yes.
Monica, lovely talking to you and to all the MSF people all around the world, very especially in war-torn areas. And in this instance, very especially in Gaza, God keep them all safe and in good health so that they can help heal other people, all the broken people that that we're going to be seeing when this horror, when this genocide ends. But thank you indeed for talking with us this morning.
Thank you very much for having me.
God bless. Okay, we're going to go to the news in a minute or two. Before we do that, I've got a couple of messages that I do want to share with you. Badrulesham, I hope I'm pronouncing that correctly. You've posted something. Badrulesham Mohammed is saying, erase and delete Israel from the world global map. No place for animal, human, child, and woman killers on earth. The world needs new World United Organization without veto and without USA and the UK. Thank you for your post. And one or two other posts that we do need to share. Things that's resonated with me. That there is just so much out on social media. But when you kind of look at all of those messages and you realize the enormity of the horror and the scale of the horror that is being perpetrated on the Palestinian people. And I've got one here from I think it is Ione Belara, and this has been translated from Spanish, by the way. She says that Israel has demonstrated in these weeks an absolute lack of humanity, asking Netanyahu to comply with an international law that he despises serves no purpose. What needs to be done is to stop him with exemplary economic sanctions and an arms embargo. That is really wishful thinking, knowing that the world superpower, America, is supplying them with all of the arms and armaments that they need. And we also understand that America has sent its biggest aircraft carrier to support Israel in this genocide. One more, and this is from Sihle Lonzi, who says that when the world finally wakes up and discovers the extent of the genocide taking place in Palestine, it will make the Holocaust look like a kindergarten. Well, thank you indeed. And one more, I just have to share one more with you before we go to the news. This is by Mohammed Al Kurd, and he says between 1947 and 1949, Zionist militias forcibly displaced 750,000 Palestinians and killed 15,000 in an ethnic cleansing campaign. Since October the 7th, meaning in just 22 days, the Zionist regime has displaced 1.4 million Palestinians in Gaza and killed almost 9,000 people. Think about that.